So guys, let's go ahead to look at the possible systemic effects of inflammation. All right. So if there's inflammation, it could be acute or chronic inflammations in the body. How will it get to actually affect the systems, various systems of the body? That's what we'll be looking at. All right. And this is the question was actually asked in an exam. All right, the students were asked what? Outline systemic effects of inflammation. All right, so you can see different disease conditions that can basically what cause inflammation. All right, so but here we're basically trying to outline the effect. Okay, so we say that typical systemic signs of inflammation include the first one that we have is what? Fever. All right. So we said that fever is the most prominent manifestation of acute phase of inflammation. All right, especially when it is associated with an infection. All right, so especially when there is an infection, there will be inflammation. Okay, and this will lead to fever. So we said that it is produced in response to pyrogens. Now, these pyrogens they act by stimulating what the prostaglandin synthesis in the cells of the hypothalamus. Then, when these prostaglandins are secreted in the hypothalamus, they will stimulate the what cyclic adenosine monophosphate to reset the temperature point to a higher center. Okay. Now, this will result in a rise in the body temperature above the normal range. Okay, above the normal range of about what 39 plus or minus 0.2 degrees Celsius. All right. So the first effect of inflammation on the systems is what? Fever. So let's complete it up. We said that bacterial products will stimulate leukocytes to release endogenous pyrogens, which are the cytokines, all right? That's like interleukin 1 and tissue necrosis factor, all right? Now, these ones will increase other enzymes such as what? Cyclooxygenase. So now these enzymes will convert arachidonic acid to prostaglandins, all right? So two mechanisms of actions. It's either they're acting on from the hypothalamus to increase the temperature, or it could be that what they're acting to directly what convert this arachidonic acid to prostaglandins. Okay. Then another effect of what inflammation is what the release of acute phase proteins. All right. Now, so that these proteins are synthesized in the liver and may increase several hundred folds due to inflammatory stimuli. Right. Now, examples of this acute phase proteins include what? The C-reactive protein, that's the CRP, the fibrinogen, the serum amyloid A protein, that's the SAA, right? So they could be upregulated by what? Different cytokines, like for example, cytokine 6, interleukin 6 will elevate levels of what? C-reactive protein. Fibrinogen, interleukin 6 will elevate levels of what? C-reactive protein and fibrinogen, okay? Interleukin 1 will elevate levels of what? Serum amyloid A protein. Okay, so you can see different impacts of um, systemic inflammations. Okay, but these ones are just basically talking about disease conditions, right? These ones are talking about the effect, all right, on the system. So next now we'll be having leukocytosis. That's basically, I think this should be elevated levels of white blood cells. So extreme elevations are referred to as what? Leukonoid reactions, all right? So now this occurs because of what? Accelerated release of cells, all right? So blood cells are being formed, but you don't really need to even wait for them to mature. You just release them from the bone marrow, okay? So now this could be because of accelerated release of cells from bone marrow. Okay, from the bone marrow post-mitotic reserve. Now the post-mitotic reserve, we're talking about, I think, basically talking about like melanocytes, the band forms, and neutrophils. Okay, so and this is caused by what? cytokines like what interleukin 1 and tissue necrosis factor. Okay, and it's associated with a rise in the number of most immature neutrophils in the blood. That's a left shift. Okay, so neutrophilia and left shifts of neutrophils points toward bacterial infections, right? So if you have neutrophilia, then you should be suspected to actually have this bacterial infection. Okay, then the last two ones, there could be a decrease in pulse and blood pressure because of the redirection of blood flow from the cutaneous to the deep vascular beds to minimize what heat loss through the skin. All right, there could be rigors, chills, anorexia, somnolence, malaise as a result of the actions of what cytokines in the brain cells. All right, so that's it about what the systemic effect of what inflammations, right? The three most important ones being the fever, acute phase proteins, and leukocytosis. All right, we have the last two ones. All right, so see you guys pretty soon.